Hi, I'm Lauren Hubele. I'm a gemmotherapy expert here in San Marcos, Texas, and I'm here with two colleagues from Europe who have had recently some interesting experiences using gemmotherapy and homeopathy with active COVID cases, with clients recovering from COVID in convalescent states. And I thought their information was too valuable not to share with all my listeners. We're in a place right now where Europe is seeing surging cases in COVID, and America is just beginning something very similar. So those of us who have made it through may not make it through the whole winter without having some COVID touch our family or community. So what we'll be looking at today is what these ladies have seen in their practices and sharing some firsthand experiences. But first, let me introduce them to you. These are both of these women have been longtime students of mine and have thriving practices of their own in their own countries. Lena, I would like to introduce you. Thank you for joining us from the Ukraine. Can you tell folks a little bit about yourself?
Yes, hi Lauren. Thank you for inviting me to this podcast. Well, I'm Lena from Kyiv, Ukraine. I'm practicing gemmotherapy for almost 2 years right now, and particularly doing some job with COVID cases because lots of people here in Kyiv are having COVID and more, So yes, I'm helping them with homeopathy and gemmotherapy. I find these um, two directions useful, particularly in this strange disease with strange symptoms.
Yeah, great, Lena. Thank you so much. And Dana Campaen, Dana, welcome. Thanks so much for joining us.
Thank you very much, Lauren, for inviting me. I'm very glad to be here with you and Lena. My name is Dana Campaen. I am from Cluj-Napoca, Romania. And I'm a homeopath and a gemmotherapist for the last decades. And now for the last month, I started to have patients with COVID symptoms. And this made me to put in application everything I learned from Lauren. And it seems that it works very well for these patients, and I'm very satisfied with gemmotherapy and homeopathy in such cases.
Donna, I'm so happy to hear that because I know going into this as a pediatrician, you were concerned whether you would deal with COVID right in your practice. So you are seeing it in your practice right now.
Actually, the cases I had were not children, were adults. And one child also, but I'm not sure if it was COVID positive because it wasn't tested. But the symptoms in children are quite different from adults. In adults, we see the classical symptoms of COVID, but in children, we see a lot of fatigue and a lot of runny nose and nausea, but not very severe symptoms.
So in children, what you're seeing is more congestion, more like colds.
Exactly.
Okay, but with the added fatigue.
Exactly. Very tired. They feel very tired. They want to sleep a lot, much more than usual.
Interesting.
I want to add, I also see the same symptoms in grown-ups, but in mild cases. It's just going like a cold, catching a cold, So they have also running nose and some low-grade fever and fatigue.
So you're seeing that also in adults. Okay. And Lena, I know you've recently dealt with some children with COVID. Any variation to their symptoms?
Well, Actually, children have usually mild symptoms. Those two had only loss of smell and some running nose in the beginning of the disease.
So you mentioned loss of smell, and that's one thing I've heard over and again. Donna, are you seeing that?
Yes, it was the first symptom. In each case, I was treated. The first symptom was this: I don't feel any smell. And but after starting the treatment, in a few days, 2 or 3 days, they recovered the smell very quickly, very quickly.
What do you attribute that to, Donna?
Well, I started to treat these cases at the onset of the disease. So it didn't last for a long, the symptoms, and maybe that's why the recovery was so quickly. I didn't have very severe cases, or maybe because I started the treatment very early in the evolution of this disease. I don't know, but it wasn't very severe, and the smell was back again in 3-4 days maximum.
Okay, okay, very good. And Lena, what would you add to that?
Yes, well, I have a different picture actually. I had two children with loss of smell, but no other severe symptoms, so they were doing quite well. Just 3 days of running nose, then they lost completely their smell, and for 2 or 3 weeks. And I even had no other symptoms. So they were quite active, having good appetite, and well, no other symptoms at all. But well.
You know, this is interesting because one of the premises I would have is that, from my understanding and listening to many practitioners dealing with this wherever that person has weakness, that seems to be the part that tends to give them the most challenge going into COVID. Is that something you might see, and might we draw a correlation with this loss of smell and that?
Not always, Sometimes people have fatigue in the first days and they lose their smell in the third or the fourth day. I had such cases also. So it depends,
Yeah, but I'm wondering if the loss of smell has any relationship to people that have challenges in their sinus area. Did you see that, Donna, at all?
No, not quite. The patients I was treating, they had no problems with the sinus area, with the frequent colds in the past. No. But I think this is one of the major symptoms of this disease. But as Lena said, there is such a enormous variety of symptoms in this disease. I mean, we cannot put a label on the symptoms, but this loss of smell is very, very common, very frequent.
Donna, when you say that this disease has so many symptoms, what are some of the symptoms you're seeing?
Well, what I saw in one of my patients, a 36 years old lady, who was very, very healthy before, never had any problems. She suddenly couldn't breathe, couldn't take air. And she told me, I feel like my airways are clogged. I cannot breathe. And this is quite a very frightening symptom. Sure. And this can lead to anxiety and panic attacks. She actually had some panic attacks. She couldn't sleep in the night without a light or without somebody by her side. And but after the next day, after I gave her a remedy and the gemmos, she told me, I don't know what you gave me, but it was just like a miracle. All my airwaves are clear now. I can really breathe as I did before.
Wow. Well, you know, this is so interesting because in all the um, podcasts I'm doing on polyvagal theory, Dana, I mean, that inability to breathe is a signal to the body that you're not safe, right? That's a very basic signal. And so she's constantly getting that message that she's not safe. So that's alerting the panic, and then it's a cycle, right? So
Yes,
what
exactly.
extracts were you using with her?
Well, I used silver lime, which is very useful in this kind of anxieties. And of course, I used silver lime in microdose for its action on the nervous system. And I used, of course, a mix of gemmos, and I change it every day.
Yeah.
At the beginning, I used blackcurrant, common alder, and lethe. And I gave this for 3 or 4 times a day. In the evening with hazel, of course. And the next day I change, and the next day, any day the symptoms were changed, I changed the treatment.
Yeah, beautiful, Donna. And that's exactly what we want to be doing, right? In an acute, responding exactly to the body. And so you were communicating with your patient on a daily basis there in the beginning.
Absolutely. Even 2 times a day, I was on the phone with my patients. I couldn't do any other way, because I need to know, because I felt that the symptoms were changing very quickly.
Lena,
I
is
think
that your experience?
I observe the same. Sometimes it seems like I'm 24 hours on the phone just answering their questions, because yes, the situation changes very quickly and they have new questions, what to do next. Like I have no headache anymore, but I have greater fatigue. What to do next? So yes, this disease is strange in this
So,
light.
Lena, when you're starting a case, is there any protocol you have found that I almost always started this way?
Well, usually I want to be sure that the person has the right gemos on hand. So I want to be sure that he has something to use, you know.
Yes.
So I usually advise to have blackcurrant and oak, because they are quite useful in the first day and in the convalescence period also. Then common alder, of course, sometimes dog rose. Lethe is very, very useful. You know, it helps a lot, because every time we have problems with breathing in, especially, it helps, yeah. Hazel, and sometimes I advise black poplar, especially for those who are who have some problems with the blood, or people who are not, well, having not very strong health, you know. Actually, this is quite an important question. It is important to understand that what is happening with the blood. So if I do not have some good results or some stable improvement in 5 or 6 days, I ask them to make the test.
The COVID test. Okay.
Not the COVID test, the blood test.
So what blood tests are you doing?
COVID tests, you know, are not so
So
reliable.
reliable.
I have cases where when people had 3 tests and only the third one showed the COVID. So all the symptoms and 2 negative tests, you know. So
yeah. So Lena, what test are you referring to that you do have
I
those?
ask them to take blood test and see some specific um, some specific things like C-reactive protein and D-dimer.
Interesting. Donna,
Yeah.
can you say more on that? Are you seeing congestion in the circulation too?
Well, not not quite a congestion. What I saw in circulation, I saw some problems which manifested as numbness in the feet, or a sensation of formication in the feet. About the COVID test, when I started the treatment in each of my patients, they didn't have done the test, and I told them it's positive, I'm sure, or I don't care if it's positive or not, I'm sure it is a COVID, as the symptoms were manifesting. But other tests I didn't do, because here in Romania people are very afraid to go to the labs or hospitals, because we have a lot of cases in the last weeks. So I didn't do any other tests. But since the patients were quite okay before this disease came, I was sure, and I know these patients for several years, I was sure that they will be okay, and they were.
Yeah.
Trust is a very important thing in this disease, to trust the doctor who is treating you, or the therapist who's treating you. This is very important. And as Lena said, they had all the gemmos at home, because they are my patients for several years, and they have a huge pharmacy at home full of gemmos. So I didn't have this problem with them.
Yes, I think this is having what you need on hand is a huge step forward, because then you can begin treating the symptoms as soon as they appear. Lena, you're in the most challenging situation, because in Kyiv, people cannot go out to the pharmacy and buy gemmos, and you're the source. So have you been able to manage that?
They can buy gemmos only from me. Yes. Well, actually, for today, I have not had a single patient with on antibiotics. So I think this is great, because although it is worth my great effort at times to persuade them not to use antibiotics and to wait, because some doctors, some traditional doctors, are so anxious, so they put on antibiotics from the first or the second day of the COVID. So I don't know why, but it happens here quite often.
You know, in America, we're seeing a very early prescription of steroids. Is that something, Donna, that you're seeing there being used often in Romania?
They are using steroids only in the hospital, for the patient who are in the hospital. For the patient who have symptoms, but they are at home, they give an antibiotic from the beginning, as Lena said, and some other things, vitamin C, zinc, things like that. No cortisone.
But the antibiotic with a viral, is this, yeah?
It makes no sense, I'm sure of this, but this is the protocol. You know, allopathic medicine has protocols. So
Right.
Well, actually, I think it's not a protocol here, but because I know some doctors who are dealing with difficult cases in hospital, they're not putting on antibiotics people, because they know it makes no sense. But there are so many doctors who do this, and this is so strange. I think in several years, humanity will have no antibiotics at all, working antibiotics.
So ladies, we started talking about symptoms. So Donna, you were giving a very clear case of someone that had challenges breathing right off. Lena, do you have some stories about particular symptoms that stand out for you?
Oh, well, I want to add, first I want to add that I have several cases when people went through antibiotics and then came to me because the symptoms did not change at all, and they had pneumonia and well, severe pneumonia and fever and all the rest of the symptoms. So this is not the decision at all. And as to the other problems. Why difficult cases? Several of them dealt with the thickening of the blood. Yeah. So this is quite difficult for me to understand when this begins to happen, when I have to start using some gemmels that will help with the blood, like black poplar or dogwood or lemon, maybe some of them, yeah. They're quite useful in this, but sometimes you do not have the right picture, you know, what is happening. They're having fatigue for several days and headache. They're having this, their feet are weighted, yeah, the numbness in the feet. But probably these are the right symptoms, and I should take this into attention, yeah.
Sure. And when we're trying to move blood and move lymph, which we need both moving in this case, we're looking at extracts like common alder is a very general one, but we're looking at sweet chestnut and horse chestnut and black poplar. Donna, are those extracts you're using?
I was using sweet chestnut also for as a tonic for the lymphatic system, and it was quite okay.
And were you using it in those cases where they were getting some numbness?
Exactly.
Yeah, yeah. And have you had any experience using the others, the horse chestnut or black poplar?
I used only sweet chestnut and common alder, but the sweet chestnut was very useful also in patients with who had some very severe pains in their lower limbs or in pelvis, especially. There was a very severe pain, and I gave also sweet chestnut, which was very good for them.
Oh, nice. And Lena, are you using all those different extracts?
Well, I am using horse chestnut more
Okay.
than sweet chestnut. I do not have sweet chestnut here, so this is the reason.
Sure, sure.
Yeah, and
Yep,
black poplar.
I'm-
Usually, my patients have black poplar, and using some of poplar um, in the beginning of the disease or when they are having these symptoms with their feet. Yeah.
Okay. So when we talk about smell restoring, because I am sure there are folks listening that still do not have their smell back, um, where have you found success? So Donna, you said it cleared right away in your cases and you were including silver lime, correct?
Yes.
Would you give credit to silver lime for that?
Not only, maybe some gemos who are effective for reducing the inflammation in mucosal membranes may be effective also, like black honeysuckle maybe.
Interesting. Okay. Dog rose, have you used that?
Yes, of course, I use dog rose at the beginning and at the end of the in the convalescence also, and this also has an action on the sinus zone.
Okay. Okay. Lena, what about you? I know you have a couple cases you're struggling with to get smell back for them.
They are getting better on sea buckthorn, actually.
Ah, sea buckthorn. I like that. Nice idea. So Megan and I on the Gemmo podcast, we talked about sea buckthorn at the end to help restore any functions that weren't restored through the process. So that's good to hear. Is it coming back bit by bit, Lena? Is that how you're seeing the smell come back?
Yes, it's like, oh, I will have a smell of something, not of everything, but I just felt that here is the lemon, for instance, you know.
Yes.
So, yeah.
Okay. Okay. So it's coming back by the days. So You know, we can look to any of the extracts that were talked about for mucosal membranes, and then looking at extracts for the nervous system that might affect that, like sea buckthorn or silver lime, or even dog rose in microdoses for that matter, because it works with the central nervous system. Ladies, have you noticed anything particular about elimination? Because in my teaching, I talk about the value of optimizing elimination through a virus so the body can eliminate the pathogens. Donna, what have you seen happens to folks with elimination?
What I've seen were loose stool, very frequent loose stools, and a lot of cramping in the abdomen, and but the eliminations were a little bit let's say upset. And I'm sure that this was because of the action of the virus upon the mucosal lining, but also because of the emotional problems they have. The kidneys were affected, and so the elimination were quite affected.
So we saw these loose stools in the beginning, then did you see maybe a slowdown in having stool eliminations at all?
No, I only had this kind of problem with elimination. Loose stool, very frequent loose stool for maybe sometimes for several days, with nausea sometimes.
Yeah, and we know that can also be a sign of the kidneys being.
Exactly.
So
exactly.
would you come in with something for support for the kidneys when you saw that?
Yes, they were also on this on some on fig on microdose, and I also gave some common birch, which helped a lot.
Right, and these were all adults, right? People over 30.
Yes, for adults, yes. In children, I never saw this kind of problems. No.
Okay, Lena, did you see things with elimination change?
Well, yes, actually, I think that those patients who are okay with the elimination are going quite better, better, with the COVID. So this is the first thought that comes to mind. And yes, I do observe also loose stools at the beginning of the disease. But later, there are some cases with constipation, like they're having loose stools for several days and then no stool at all. And they explain to me that they are not eating or they are not having something. But I explain to them that this is not the problem. They have to have regular stool. So we are working on this. Yeah.
Sure. I wonder how much the nervous system plays into that, because that certainly is affected, this level of fear. Would you think that's true in your cases, Lena?
Yes, I think so. Usually these people are quite anxious, and also those homeopathic remedies I find useful for them are also speaking about their anxiety.
Sure, sure. Donna, you look like you have another thought on that.
Well, anxiety is quite a problem for everybody in this time. And I'm sure that kidneys are the first who are suffering because of this. And people who are not taking care of their elimination and of their diet and of their daily routine to be at least comfortable, I'm sure they will have problems with elimination.
Right. And I think if you go, what is the state of your body when the disease comes plays out tremendously. So if you're already coming into it with poor elimination and weak kidneys, we're going to see clearly where the problems are as the disease moves through. Yeah. So what about convalescent, ladies? Like, what are you seeing has been useful for supporting folks getting their energy back, getting elimination online? and with any other symptoms. Donna, what are you using for convalescence?
In convalescence, I used common birch, and I used hazel on microdose. And sometimes if the respiratory problems were very deep, I used hazel in full dose for several days after the disease was cured. The anxiety disappeared. The next day they felt a little bit better. So from this point of view, they were okay. But I was thinking also about sea buckthorn to use in convalescence for these patients.
Yeah, I think sea buckthorn has so much to offer in its ability to modify pH in the regions where there might have been inflammation and preventing pathogens to thrive. We're coming out of this surely not in a super strong fit state. So taking some time to take Gemmos for Donna, what's your recommendation for your patients? A few weeks afterwards, or what are you telling them?
Well, I keep in touch with them, so I don't tell them how long they will have to take the Gemmos. After they were getting better, of course, I didn't keep this 24 hours in touch with them, but I am keeping in touch every week. So for 7 days, I'm telling them what to take. Then for another week, maybe something else. Or you have to keep in very close with this kind of patients.
Yeah. And Lena, what about you?
Well, I also use sea buckthorn and common birch, and also blackthorn sometimes when people have used some medications, you know. So this remedy is quite helpful in these cases. I also advise them to use in future some hazel to restore their lungs better, especially in the cases when they had pneumonia. So hazel is very good for lungs. Yeah. And also some oak, because some people usually have fatigue for quite a long period of time.
Lena, what are you seeing about the length of this progression? I mean, you have some cases I know that started months ago even. What is it taking someone to come all the way through when they're treating this naturally?
It's a difficult question, you know.
Yeah.
Yeah, because it depends on the state of health on the at the beginning, before the disease, before COVID.
Sure.
And it depends on age and on nervous system state of the person. So I had cases like 3-4 days and also for 3 weeks.
Okay.
So
sure. And
quite different.
Donna, what about you for length of time for cases lasting?
Well, as I told you before, I have cases only in the last few weeks. So for the moment, all of my cases were okay in about 10 days, maximum 2 weeks. But we have to be very careful with these cases of COVID, because we never know what will happen in the future. As Lena said, there are a lot of coagulation problems that can start even after the patient gets well. So we have to pay attention to what will happen for the next maybe 6 months.
Sure. So if I'm hearing that, what I would say is, you know, as a doctor, you're monitoring them. Might you keep them on some sort of Gemmo protocol throughout that time?
Yes, I never stop the entire Gemmo protocol, but I change it very often. But I reduce, of course, the Gemmos I give, but I never stop them.
Okay.
What I have noticed is that they're going to more chronic state, like the symptoms do not change quite often when they are in convalescence period, but they do change. And sometimes we have to change the gemos also, yeah.
Ladies, I have a really important question for you. If I'm at home and I'm listening to this and I want to be ready, and I want to be ready to take care of my family or myself, what advice would you have for me? Donna, what about you?
Well, first of all, have a lot of gemos at home. I advise you to have, I have a list for my patients with the gemos and their homeopathic remedies to have at home, no matter if they will need them or not. It's better to have them there. And take a good care of your emotional immunity, because this is very, very important in these days. And it is very difficult to manage with what's happening, especially here in Romania. It's quite a crazy time these days. And take good care of what you're eating, do some exercises, even if you are obliged to stay at home, even if you work at home. Take a walk every day outside, take deep breath in the air. It's very important.
Yeah, very good, Donna. Lena, what advice do you have?
Yes, I also have the list of proposed GMO extracts for everybody. And also, usually I give the list of my own advices, like you have to sleep good and to be very attentive to your sleep, because COVID actually makes some changes in this. Even people who did have good sleep have problems in COVID. So pay attention to your sleep and add some gemos if they're needed to restore your sleep. Then please drink more water or more tea. I propose at least 4 liters a day for an adult, not less, because it's important for elimination, it's important for blood, it's important um, for for everything, Then plant-based diet, of course. If the person is not on plant-based diet, I usually ask him to make some changes for this period. It's very important to restore immunity in these particular days, by changing the diet. And also, yes, make some exercises. It's very good advice also.
Great, great. So listeners, I'd like to direct you to a couple places. You've had a great deal of rich information here shared. Thank you, Lena and Donna. You're looking for what gemos to have on hand. I want to direct you to the podcast with Megan Etheridge on 20 gemos everyone needs on hand for the coming months. If you are looking to restore your emotional health, I want to direct you over to polyvagal explorations and learn how you can manage your emotional health and your autonomic nervous system through life, through exactly what we're all making it through each day. And then when you do get anxious and you're challenged, I have some short podcasts in the area called the breathing room that can help you balance that autonomic nervous system right away. Wonderful wisdom from several practitioners with the practice right in them, very short. You can listen to them while you're chopping vegetables for your family's dinner. So there's a wealth of information here for you. We want you to move into this season feeling confident, feeling like you can do this, and that you have what you need to take care for yourself and your health and your family's health. So perhaps you've been listening and wondering how you can work with a practitioner with gemmotherapy or homeopathy for your COVID symptoms, or are concerned about the future exposure to COVID. I would ask you to head on over to my website, laurenhubile.com. In the middle of my landing page, you'll see a button, consult with an expert. That will take you to a link that where you can find all of my interns and Gemmo pioneers who have worked with me for many years in bringing the system of restoring immunity forward with gemmotherapy. If you can't find that button at the bottom of the footer on the web page, you'll find a Find a Practitioner link. And I wish you all the best with your health and supporting your emotional and physical immunity as we move into these winter months ahead.